John Farrelly from Sage West Healthcare, standing in the lobby of the Wind River Clinic and Wind River ENT over in Riverton, and I'm joined by Katie Anderson, who's the Director of Clinic Operations. As we start to step back up and get back to normal operations, we want you to know that patient safety is our utmost concern. So if you have to come into the clinic, Katie's going to walk you through what precautions the staff take to ensure your safety.
Yes, as John said, we are really focused on ensuring that our staff, our employees, our physicians, and our patients are safe while they get the care that they need. You can look around the clinic when you come in. You'll see that each of our chairs in the waiting area is stationed at least 6 feet apart. We are operating under a no visitor policy right now, which simply means only bring those with you that need to come. If we have a pediatric patient, please only one well parent with that patient. If we have an elderly dementia patient, again, one guardian with that patient is appreciated. We also are operating, obviously, as you can see, under a universal masking policy to ensure that we're controlling the source of the infection as much as possible. I have with me today Jackie and Alicia, who are our front desk staff, and they're going to greet you when you come into the door to Wind River Clinic. And I'm going to let them explain a little bit about the processes that they undertake in order to ensure everyone's safety when they come in our building.
Okay, so when you come in, we have you stop and sanitize your hands at the front door. If you do not already have a mask, we ask you to put one on and we will give you one. And then we will take your temperature to make sure that you don't have a fever. If there is a fever, we take you directly to an isolation room.
We try to limit the amount of people in our waiting room at one time. So we are asking some of the pediatric patients to stay in their cars, and we bring them in one at a time. When you do make an appointment, we do go through some questions. It's a screening questionnaire about your symptoms, whether you've been exposed to anyone that you know that may have a virus, or what kind of symptoms you might be having.
Great, thanks guys. So let's go back into the clinic and look at what happens once we're back in an exam room.
All right, now we're back in our clinic area at Wind River Clinic, and I have with me Brittany Hawker, who's one of our nurses who is involved in the care of our pediatric patients. Brittany, do you want to let us know or tell the audience about how we care for our patients safely?
Yeah, so we've removed all the toys and all the items out of the rooms. We are scheduling the patients apart so that there's plenty of time in between each patient so we can fully clean the rooms in between every patient. We're having the patients stay outside in their cars until we're ready for them, and so they do not have to wait in the waiting room. And every night the rooms get deep cleaned in between patients so we can schedule healthy patients in the morning and sick patients in the afternoon to keep those separate.
I think the important message here is that we are doing everything we can to really ensure the safety of our patients and our staff. On top of this, every one of our staff members, physicians included, gets screened and scans their temperature when they come in the morning. And in the bottom line, if you don't feel safe, we still offer telephonic and televideo visits to maintain your health care during this time.
So Brittany and Katie, thanks for everything that you do to keep our employees and our patients safe. Thanks everybody, have a great day.